My name's Claire Hunter and I'm the training lead for NHS Pathways. Call handlers who are new to using a clinical decision support system go through a 2-week or the equivalent of a 2-week training programme on Pathways, and that focuses very specifically on the skills that they need to be able to use the system in a safe and competent way. So the first thing that they do is they complete a distance learning pack which focuses on some basic anatomy and physiology and pathophysiology, so what can go wrong with the body. Then they complete about 9 days really of very, very practical experiential learning where we actually get them on the system from a very early stage and throw lots and lots of different scenarios at them and get them to be very confident and as proficient as they can be within the training programme, within a fairly short training amount of time to use the system. We cover things like questioning skills, listening skills, and we also cover negotiation skills because that's quite an important skill for staff who are working within the health service to be able to negotiate with patients, because sometimes what patients want isn't always what they need, so staff need to be able to find a way through that. And we have quite a few assessments within the course, so everything that we teach them is assessed, both practically, so we will observe them taking calls, and we also have some written assessments which focus on the anatomy and physiology side of things, as well as the system concepts and the really important things that they need to be able to understand the system. We tailor the training to staff working within out of hours and different organisations such as PCTs according to the types of calls that they're likely to receive. So any call handler going through the 2-week programme will cover the same principles, so they'll all do things around questioning and listening and negotiation, and they'll understand the basic architecture of the system. But the practical examples that we get them to practice on are very much tailored to the types of calls that they will receive. So for example, when we deliver the training to an ambulance organisation, we will give them a lot of scenarios where people are experiencing serious medical conditions or serious injuries. We don't solely do that. We do give them some less serious, less urgent scenarios, because of course not everybody ringing the ambulance service has an emergency health need. We would tailor training to staff working within PCTs so that the scenarios that we give them, the practical exercises that they practice on, would be much more tailored to the types of calls that they're likely to receive. So whilst they would cover the same fundamental core subjects that any call handler would going through the course, they will still do questioning skills, listening skills, so on and so forth. The scenarios are much more focused on the types of calls that are likely within the out of hours period. The safeguards that are in place really around call handlers doing this role is that they don't actually diagnose over the telephone. The system isn't diagnostic, it works on the basis of ruling out. So it will rule out the possibility of certain conditions being the cause of the person's symptoms. So I would think that's the first safeguard that's in place. We're not asking call handlers to diagnose. But any organisation that takes on Pathways has to have in place a very robust system of clinical support for staff. So they have to have people that are there and accessible real time for call handlers if they reach somewhere where they feel they're out of their comfort zone. The other thing that we stress and is inbuilt into the system is that anybody that calls the organisation using Pathways must be given what we call worsening advice, so that whatever happens, if things worsen, if symptoms change, or if the person becomes concerned after putting the phone down, there's still a lifeline and they're instructed to call back. So that's a really important risk measurement safeguard that we put in place. There's a lot of advice that I'd give to a call centre looking to implement NHS Pathways. I think one of the main things would be not to underestimate the cultural shift that is necessary for an organisation to take on Pathways. It's not just about using a new system. It is very much about staff adopting and embracing a new way of working, and that can take time, and often it's not without its hiccups. So it's to be aware of that and to start your change management procedures early rather than late on in the day. I would also say that one of the important things is not to think that training is the be-all and end-all or the end of the story, in that once staff are trained, it's really, really important that they're monitored and that they're supported, and that you have a really good handle on levels of performance, and that you're able to respond to any problems quickly with the support that staff need.